please. I know we have, I'm trying to hit, oh, how do I show present? Since it's not a touchscreen. Yeah, okay. Yeah, and we have excused absences from Commissioner Marecki and Commissioner Scott. So we have a quorum, Madam Clerk?
Yes, we have a quorum present.
Thank you very much. Next item on the agenda.
B, Chair's remarks.
I have none today. So we'll move the agenda.
C, approve the February 6, 2024 meeting minutes.
Pleasure of the committee. It's been moved by Commissioner Baker McCormick, supported by Commissioner Anderson. All in favor? Well, we vote, and I'm getting used to this.
Motion carried.
Thank you very much. What's next, Madam Clerk?
D, unfinished business. There is none listed.
All right, we'll roll the agenda then.
Item 1, under new business, requesting commission approval of Amendment 1 to a 3-year inmate health care services management agreement with a 2-year option to renew with NAVCare Inc. to provide all medically necessary health services for adult jail inmates and pharmaceutical support services for the juvenile detention facility.
Thank you, Madam Clerk. Somebody presenting from administration. This is the First Amendment to a 3-year contract. We're 2 years into that contract, and this is the First Amendment. So first I'll ask if I stated that correctly, and then I'll ask you to present what's in the First Amendment.
Good afternoon, through the Chair, Ebony McCann, Department of Health, Human Veteran Services, Division Director, Transition Services.
Good afternoon, everybody.
Yeah, get it right up on you, Doc, because it's.
Good afternoon, everybody. Keith Dugokensky, Health, Human Veteran Services, Correctional Healthcare Administrator.
Thank you. So what does the First Amendment do?
So you were correct in your statement, Commissioner. We are 2 years into a 3-year agreement with NAVCare. This First Amendment aims to accomplish the following: incorporate key performance measures, add a cost savings model for those key performance measures, as well as make modifications to the staffing matrix that was included in the original agreement, Additionally, we are requesting to reallocate funding to align with the savings for years 1 and 2.
All righty. Anything else you want to mention? I see there's things like increased staffing.
So that is included in the matrix, the staffing matrix. So we identified during the course of this agreement that there are some staffing positions that are essential to the day-to-day operations of our jail health staff. And as a result, Dr. Keith and at that time, Jordan Hironick worked extensively to discuss with NAVCare to make sure that their needs were met as it pertained to adding or incorporating additional staff to meet the needs of the inmates inside of the Wayne County Jail.
All right, I'm going to ask one more question about that and then go to my colleagues for questions that they may have. Is the additional staff, because it's like 29.5 people, like 30 people we're adding. Is that in response to the Michigan Department of Health and Human Services and the requirements of the state of Michigan as far as staffing levels go?
So I don't believe that, and I'll allow Dr. Keith to speak at length, but I don't believe that had any bearings to the addition of the staff. I think that we found that there are some services that are essential to the day-to-day operations of jail. So there are provisions for a medicated assistant treatment therapist and staff that fall up under under those guidelines and criteria. There are also additional nursing staff that are necessary to deal with the increasing average daily population of the jail. When we entered into this agreement, it was right at the onset of COVID pandemic. And so the average daily population, for inmates was significantly lower. And we are seeing that there's an increase into the average daily population of inmates. And so we just want to make sure that we have the appropriate amount of staff on hand to deal with the increased needs inside of the jail. Dr. Keith, if you'd like to speak any further regarding that, but I don't think that it had anything to do with the Michigan Department of Health and Human Services.
Yeah, again, good afternoon. Keith Dugo-Kensky, agreed. The staffing matrix was built sort of at the beginning of the pandemic. And at that time, the ADP of the jail was, 700-800.
Average daily population, sir?
Yes, the average daily population of the jail was 700 or 800 or so. And the matrix just was not adequate to go ahead and cover what eventually have come to be a greater number of people that are in the jail on a daily basis. And we're anticipating as well a greater number of people as we move into the new facility. So we've taken a look at all the critical areas, just as Director McCann had said, nursing, providers, all of our mental health folks, and try to make sure that the new matrix would be built to cover what will be the upcoming year. And we're hopeful to cover in the future years, should we continue with a renewal that is an option in this contract.
Okay, I'm going to get to my colleagues in a sec. Just a couple more questions specifically on this. So your last name again, ma'am?
Ebony McCann.
Yeah, Ms. McCann.
Yes.
Sorry. So you spoke to a couple of specific job titles in this. Those weren't a part of the original matrix that we fill those jobs?
They were a part of the original matrix. The number of actual staff that fill those positions were modified in this current matrix.
Because of the 700
Correct.
average daily.
That is correct.
So we were saving on staff for a couple of years because of those lower numbers? Is that an accurate statement?
There were overall cost savings to the total contract for years 1 and 2 as a result of the reduced average daily population of inmates.
Yeah,
yes,
so we saved some money there. Now
Right.
we're spending it.
that is what we are aiming to do.
Okay.
Yes.
With this. All right. Thank you. Let me turn to my colleagues. Questions? Commissioner Anderson?
I just wondered, I know when we did the transition to a vendor for the healthcare, we had a number of employees that were county employees. How many of those are still around? Just curious.
Yeah, again, Keith Dugo-Kensky, I'm not sure the exact number, Commissioner. Have to check on that and get back with you. I know there has been a fair amount of transition in that group. We moved to a vendor January 1st, 2017. So that's been several number of years ago now. And as with any organization, just being part of it on a day-to-day basis, I know a number of those through attrition and whatever all else have moved on to different positions. Nobody has ever been, forced out, asked to leave. So anybody that wanted to continue to stay with the original vendor to the new vendor was allowed that opportunity, but I don't have an exact number.
Okay. And so the results of the activity or of this company, it's been satisfactory. It worked well. I'm assuming we wouldn't be looking at this today unless it was satisfactory. Has it been as good as the previous vendor?
I can only speak to this current vendor, and Dr. Keith, who handles the day-to-day operations of and oversight of this contract, can speak further. But based on my experience, which is quite limited, I am satisfied with NAFCARE. It appears that they successfully addressed and responded to the COVID-19 pandemic in a favorable manner. We work closely with them. We meet with them frequently to discuss challenges as they present themselves, and we work to resolve them in a timely fashion. As it pertains to the previous vendor and comparing NAFCARE to, I believe it was WellPath, I think Dr. Keith can speak to that as he provided oversight of that contract as well.
Yeah, so this vendor, as you've heard Ms. McMahon say, has really delivered on all aspects of the contract. They've been a great partner. They've been responsive, and we look forward to what is yet to come in terms of our improvements. One of the things that we wanted to go ahead and do here is make sure, first of all, that we had enough horses to kind of pull the wagon. 2 years into the contract, we've done a kind of complete review of the matrix. Do we have all the right people in all the right places with the right numbers? And that was part of the review. And again, because this was kind of built on a pandemic average daily population, the original number of FTEs, which I think was 74, was really very light, even relative to your point, Commissioner, the previous vendor, where we had over 100. So we've adjusted that with adding these new spots. And in terms of the quality, we have all along been very active with key performance indicators that we review on a monthly basis and then formally, review quarterly. And those have been good numbers, and they are right now formally incorporated into this amendment. So that was part of the amendment that you have before you today, was to formalize what it is that those things were going to be that we were going to measure as quality, and put them into the contract. So that was part of the amendment that, again, you have before you. They were not in the original contract. I think the original language advised that they would be developed as we identified what was needed to really be measured. So they are now part of this amendments before you.
One last question, Mr. Chair.
You got the floor.
Have we had any lawsuits as a result of the care that's been provided by the vendors? Either one of those?
Yeah, the landscape there is always that there are incidents, suits. I can't tell you the exact kind and or number, but just knowing that, it's not unusual. It's kind of almost SOP, and I don't mean to be dismissive or minimize that. But, it's a typical occurrence in a correctional healthcare setting. So I expect there have the kind and the number. I'm not exactly sure, Commissioner.
The one that comes to mind is the gentleman that was, I think he was intoxicated, that was jailed, and he was put in with someone. I know that's a decision of the deputies that are in the jail at the time, but I wondered, was there any oversight or failure of oversight by the mental health? You guys, these vendors would handle the mental health too, correct? That they failed to notify the jail personnel?
We definitely do provide oversight for mental health as it pertains to an actual lawsuit. We have not been made aware. I think that is something we could raise or inquire with Corporation Counsel. But we personally, or the department, has not been made aware of any legal action that has been taken as a result of that case in particular.
Right. Thank you. Thank you.
Thank you, Commissioner. Commissioner Baker McCormick, do you have? You're good? Okay. A couple other questions that I want to ask about with regards to this. The language I get was that the key performance indicators were adjusted. So what was the reason for the adjustment? What were they adjusted to?
The amendment before you in paragraph 3 indicates that per the language in the initial contract, as Dr. Keith indicated, that we, HHVS and NAVCare, developed the key 14 performance indicators that are being implemented in this amendment before you today. So as Dr. Keith indicated, the contract stated that we would work to develop those key performance indicators. And as a result of us working, that's what you have before you today.
So the key performance indicators have not been a part of the contract?
Because it was a new agreement, they were not included in the original contract. But now, 2 years into the agreement, we've identified that these are the metrics that we'd like to track. And as a result, we identified these 14 key performance indicators.
Okay. But we really didn't have any prior to this?
a number of things that were included in the contract under the SLA section of the contract. So
LA, sir?
there were service level agreement issues that we were taking a look at, staffing. That was all part of the original contract. And one element of those service level agreement items were the key performance indicators, which, as you've already heard stated, were to be developed at a later date. So they were added to the service level agreement matrix of the contract, which also had some other measures regarding staffing and things that were included. But in terms of the actual clinical services that were being delivered, these are now the first formally agreed upon key performance indicators. So they are new actually to the contract.
Good thing to have in there.
Absolutely. We've been using them incidentally over much of the course of the contract, but now they're included in a formal way.
Thank you, Commissioner Baker McCormick.
And just to follow up on that point, is there a ongoing set of dates where you will look at those indicators and kind of see where you are and provide that report to us? And at what point is that?
We receive the report quarterly. And that is definitely something that we can share with this committee as we receive that information.
Yeah, because it's, of
Thank you.
course, we've heard of incidences that, I mean, aren't very good that's happening in the jail. And we just want to, I know you're doing the best with what you have. I know there was a staff shortage and you're dealing with that. But yes, if you can keep us abreast of where you are as far as the key indicators. Thank you.
Is that it, Commissioner?
Yeah.
Thank you. Along those lines, the 3 years on this contract is up at the end of September, October this year. But they do have a 2-year option on that. So with the key performance indicators, could you come to this committee maybe a month or two before there's a motion to take the 2-year option and have a discussion with the committee? I don't want to do it on the day that the option is being considered, because that's a lot of data, and maybe come talk to this body about your key performance indicators, anticipating a possible 2-year extension. I think that would be to help illuminate for the commission. Is this a step we want to take or not? Does that sound like something we can do?
I believe, through the chair, sorry, I believe that we absolutely can come back prior to the end of this contract to share the key performance indicators that we've received thus far to discuss the amendment moving forward.
At least this member of the committee understands that these are relatively new, but this is a guidepost we have for this contractor, perhaps any other contractor that comes in there. This is what we're looking for. So I think to have a picture of that before we talk about a 2-year would be good. So, okay. Commissioner Baker McCormick?
And I was just gonna say also, because we're moving to the CJC, maybe there might be some other factors that play into the key indicators, and maybe, I don't know if that's a moving needle, but I'm thinking with the move there might be, and so it would be good to come back anyway with where you are on that.
So noted. Thank
Mhm.
you.
And we'll talk to the chair about that. Couple other things, in my squib, whatever you want to call it, that we're adding 30 people based on the population being 1,400. It also says the division advises that it was determined the staffing needed to be improved in several areas due to recent National Commission on Correctional Healthcare reaccreditation and the anticipated U.S. Department of Justice settlement agreement regarding jail medical care. So there were some external factors that we said we got to boost our number of people we have. Maybe I suggested Michigan Department of Health and Human Services requirement. You were like, no, but there is something else that's
There
impacting.
is through the chair, there is an ongoing NCCHC National Correctional
Yeah.
Care Health study or audit that has taken place that we are working in collaboration with Wayne County Sheriff's Office as well as NAVCARE's administration. And then there is a Department of Justice investigation that has been ongoing for some time now. And so as a result of those conversations, there have been things that have come out of those discussions that we implemented in our day-to-day operations with the oversight of this contract and have moved forward with including them in this amendment. And ultimately, if this honorable body approves, we'll make provisions to allow those provisions to translate into an upcoming renewal.
Well, I think that provides a fuller picture of the environment that we're in. And I think it's important that the legislative body has that fuller picture. Could you discuss well, first of all, this is a cost plus contract. We don't see a whole lot of them come through the commission. Can you describe how that works with this? We're on cost plus. What does that mean? Don't have to go too deep into it, but just
Yeah.
as a reminder.
Again, Keith Dugokensky, Health Human Veteran Services. And so I'll just give a 50,000-foot view. I'm not part of the finance, but as I understand, the contract that we have is essentially where it is are in charge of and responsible for all the expenses associated with the service delivery, and that there's an administrative fee that is added into that for the vendor, which creates their, profit. So,
So they,
that's how the contract is
so they
structured.
contract with somebody. They contract with somebody?
They have several subcontractors.
Yeah, to bring services into the jail.
Correct.
And then we get a copy of the contract. We pay for that contract as a county. Right? The money comes. All right. Can we let the finance guy walk us through it?
Kamal Kaparu, Management and Budget Finance Director for the Department of
Welcome,
Health,
sir.
Human
Thank you for coming.
and Veteran Services. Dr. Kiefer is right on target. The only thing I add in is when it's, as you stated, cost plus, but it's still passed through. So we only pay what the actual cost is.
Yeah.
So even though they may contract with somebody else, once we get those bills, it's based on the actual cost. Now, also, I didn't look at the most current contract, but when there's a cost saving, like if it's under budget, the county and the NAVCARE, we split that initial cost. So if there's a savings of, I think it's 50,000, I forgot the exact amount, but it's split, that initial savings. But everything is based on actual costs.
Okay. And then there's some other things in there. We're not cost sharing if it's too high over or too far under, that kind of thing. And this kind of reminds me of contracts with road projects, right? Get them done early, there's a bonus. Get them done late, we're going to penalize you. And they pick up administrative costs, right? That we don't have to have anymore through this contract?
I don't
I don't know.
understand that. They do have an administrative cost in this
Yeah.
contract, but it's the same thing that WellPath had. So it's to cover
Okay.
their administrative services.
But you have a lot of work to do when they send over, this is the actual cost.
Yes, we do. Of course, we have to vet the cost, and I'm gonna look over to Marcy. Thank you, Marcy. From here, we do quarterly fiscal reviews on these contracts.
Okay. All right, sounds good. I saw one of the subcontractors in here. Was McKesson? I'm familiar with that name because wasn't it part of the county's opiate lawsuit? Didn't we name McKesson in there? Just wondering what that was and why the name pops up again. While he's doing that, who is our MAT provider, our medically assisted MAT? What does that stand for again? Therapy?
Medication assisted treatment.
Medication assist. I knew that. Yeah, and this is, yeah. Who does?
NAFCare.
They do it themselves?
It's incorporated into the
Okay.
NAFCare contract, yes.
They have that. Okay, and I think beside the McKesson, let me check one more time that I covered my questions. So other than the McKesson, and that can be submitted, please, to the, I don't know if, Corporation Counsel wants to submit that. Unless Corporation Counsel happens to be here and has a comment on that now.
Through
Oh
the
my
chair,
goodness.
I don't see that name that you spoke of on the opioid list, but that don't mean it's not a part, but on the list I
Yeah.
have. Oh, yeah, that's not them.
Yeah.
That is, okay.
Yeah.
Yep, they're there.
Name and title for the record, please, sir.
Chair T.R. Winter, lead attorney from Corporation Counsel.
Yeah.
McKesson is one of the largest national medical distributors, and you are correct that they were part of the opioid settlement, and they've also been parts of various emergencies with the county, including COVID and possibly even the one at the JDF where we had to do emergency contracts at the beginning of COVID with
Yeah.
them to get medical supplies. They are getting close to being monopolistic or oligopolistic in terms of they have a lot of ability to obtain certain items when they're in shortage that other places don't have. They're like the staples of the medical supply industry.
The Radar O'Reilly of the come up with anything. So, okay, so they're a big player. Did they eventually, because you do a suit like we did for opioid, you just hit everybody, right? And I was listening to Doc talking about the lawsuits, and Ms. McCann talking about the lawsuits. I come out of high school education. Every principal in this country has been sued 4 or 5 times. When you have a lawsuit, you just hit everybody, right? Was McKesson dropped from the suit?
No, they have settled with the county.
Okay.
The strategy or the results of the opioid lawsuits were that both a lot of large retail pharmacies, including the ones we know like CVS, as well as people like Kroger and Walmart have been settling. And then regional players like Myers might settle in the states that they operate in.
Yep.
And then some of the large distributors have also settled, and they are one of those as we've confirmed.
So Corporation Counsel doesn't have an issue that we have other contracts with this company?
Not in terms of the fact that they are a supplier of necessary products that we would have difficulty.
But nothing about the
obtaining.
lawsuit says we can never do business with them again.
No, that there's no interaction with that. It's just that different entities have settled and with some in like a multi-party settlement and some on their own.
Okay. I saw it, so I wanted to raise it. Thank you, Counselor. Questions from committee members? Pleasure of the committee, and I'm still struggling with my screen. Do we have a motion from? Commissioner Baker McCormick moves item 1. Oh, I could look at Chris, but he doesn't have a vote. So it's been moved and supported, Commissioner Anderson, or Commissioner Baker McCormick, Commissioner Anderson. And, any further questions on this? All right, let's put it to a vote. Tap your screens, please. No, don't tap them. Put the pointer on it. And then tap that, as they say.
Motion carried.
Thank you very much. And thank you, everyone. Madam Clerk, what's up next?
Moving to the addenda, item 2, requesting commission approval of amendment 4 to a 5-year professional services contract with Southeastern Michigan Health Association to account for allocation adjustments for certain COVID-19 pandemic response activities and other public health programs.
All righty. Thank you. Name and title, and what are we looking at here, ma'am? Is your mic on?
There we go.
Thank you.
Avni Sheth, Chief Medical Officer and Division Director at Wayne County Health, Human and Veteran Services. This is Amendment 4 to our 5-year contract agreement with the Southeastern Michigan Health Association, SEMHA, who provides staffing services, HR support, and administrative support for several of our programs across HHBS and also JYS, Department of JYS. And so this current amendment does not increase the total contract value amount, but reallocates certain funding from programs that needed less or a decrease of funding or are closed down, and adjusted them to programs that need increased funding.
Righty. Committee members, any questions on this contract? If I can get in a couple, I'd like to. So SEMHA is now covering the work of the CPBC, that comprehensive, forget what that all stands for now.
Yeah.
From the state of Michigan, where they send us about 30 million a year to do different programs on their behalf. Is SEMHA doing those now?
So no, the funding still comes to us at
Right.
the Wayne County Health Department.
But it
and
looks
we
like
have-
the funding then goes to them through this.
No, so there are certain programs that we receive from the state that do have some fluctuations in programming
Right.
and they, ramp
Right,
up
we
and
get
ramp
3 or
down.
4 amendments
so-
a year.
Exactly. So there are certain staff that are SEMHA staff that are funded through this SEMHA contract, but then there's a larger county employee team that is funded under the CPBC agreement.
So
So the
what's their,
core team
Yeah.
is
so
Wayne
what's the
County.
role of SEMHA then and the CPBC?
So SEMHA supports certain programs only under the CPBC, so not every program
Some
has
may
a.
do totally themselves. We send them money and say, go take care of this.
No. So we operate all the programs under the Wayne County Public Health Division under the CPBC agreement. We go to SEMHA for staffing for certain programs that are new or emerging or have, kind of dynamic sources of funding. So they're still operated by the local health department
Okay,
of Wayne County Public Health Division.
all right. I saw
Mhm.
their name pop up. But that does lead me to the next question. Then one of the conversations that always comes up around SEMHA contracts and a few other is that we're hiring people to do county work. And then the conversation turns to why are we not hiring people ourselves and why are we hiring through agencies or whatnot? And the consistent answer to that is, well, we need people in here. But with the people that come in on this kind of temporary basis or whatever it is, that we'll be looking to make county employees out of them. An answer that we get quite often at this table. Have we actually hired as county employees any of these SEMHA folks that have over the last 3-4 years or however long they've been providing staffing? Have we actually turned some folks into county employees?
Yeah, so yes, we have, and that is always our intent, and priority is to create county positions and fill those county positions. And we've had some really successful, especially in the nursing department, where we've been able to, the temporary staff that we needed to ramp up the COVID response, we were able to fill a few of those nursing positions, county nursing positions, which we are very keen on fully filling. So that does happen, and we are always, engaging them in our current positions at the county.
Yeah, here's the old, yeah. And instead of a long protracted discussion of this today, since it does come up so frequently, I think it'd be great if it was reported to us right? That over the last 6 months or over the last year or whatever, that we've contracted for outside vendors. And since we told you we're trying to hire them, yeah, these 6, these 8, whatever. And I think it would help the conversation here to have that kind of information we can report through hiring people temporarily through agencies. Have we actually
If I
hired
may,
people full-time?
yeah, Dr. Abdullah Sayed, Director.
Welcome to
Health
the
Officer.
conversation, sir.
Yes, I've entered the chat. I do want to push back on the premise there. There are several contracting companies with whom we work where there would be a one-to-one translation between a county job and a contractor job. So at the JDF, for example, the goal was to hire from amongst the contracted staff. That is not exactly the entire role of SEMHA here. As a public health agency, the nature of our work ebbs and flows. Nobody expected there to be a gigantic pandemic for 3 years, right? Nobody expects the oncoming potential risk of measles. And so we need to retain the ability to contract as we need to address the ebb and flow of the work, which is not necessarily to say that we would be creating an on-ramp to permanent county jobs. That is to say that we actually sometimes, given the ebb and flow of CPBC funding and other funding, we need to have the ability to actually just contract temporary staff in the setting where we have temporary work or temporary funding. So the argument that, you know, we should be held accountable to a performance indicator about how many of these people become permanent may not actually capture the intended use of the contract. Does that make sense? Because there are circumstances where we're not going to have a permanent job. We actually just have a temporary job, and we're not going to be able to hire that person on. I will also say that we're very, very proud of the process of collective bargaining, collaborative bargaining that we've just gone through. And our relationship with our permanent staff is one of collaboration and support, and they understand the explicit need to be able to augment our services with SEMHA staff. So I just wanted to push that back because I think the premise is not a simple mapping, kind of like it is at JDF or other places where you may not have to be able to accommodate unforeseen circumstances in temporary, if imperfect ways.
Well, thank you, Mr. Director. And I don't think anything in my question was something had to be pushed back against. I was not suggesting any performance indicators like you haven't turned these jobs into full-time county jobs. Let's have a fight. None of that was suggested. What I have known at 16, 18 years at this table is that when we go to outside for hiring and we have the conversation I suggested, and then administration says, oh, we're going to do everything we can to turn these temporaries into full-time. And I understand what you're saying too, sir. It might only be a 6-month job, which doesn't mean we turn it into one. But what I'm saying is give us some feedback, right? When we bring somebody in as a full-time person under one of these employment agency arrangements, how often do we get a full-time county employee out of that? And given the discussion that's been at this table forever, I think having some idea, I'm not talking about a performance index and what percent, and because you're right, there's a lot of complications here. But if we are being successful through these efforts of bringing people into full-time county employment, given the conversations we've had here, I think to report back to us, and I guess we have had a few that we've done that with, and that's all I'm suggesting. Because it's something that will be raised probably every time we have a contract for hiring out. So we just have a little data and it's part of the conversation, and it's like, yeah, actually it does happen. That's all I'm suggesting. Okay. Colleagues, any other questions on item 2, the amendment 4 to the 5-year agreement with SEMHA? Any other questions on this? And Commissioner Anderson moved this. Commissioner Baker McCormick supports us. Any other questions? All right, let's go to a vote. All in favor of item 2?
Motion carried.
Thank you very much, and thank you. Madam Clerk,
Item 3, requesting commission approval of the reappointment of Eva Garza Doelshi to the Detroit Wayne Integrated Health Network Board.
okay. We have two nominations before us. Both from the city of Detroit. The Mental Health Board has appointments from the county and from the city. These are two of the mayor of the city's appointments, and they have both been on this board. I know Dr. Tagg, who's item 4, has been on the board at least, she might have been on the founding board when we became an authority 12, 13 years ago. And Ava Garza, DeWalsh, can't quite have it, has also been sitting on that board for at least 3 years. I guess they're not with us today. Well, I don't mean that. They're not in the room today. I don't want to make any final judgments. Yeah, so committee, what's your for 3 and 4? So for items 3 and 4, the reappointment of the mayor of City of Detroit to the Mental Health Board, Commissioner Anderson moves them. Commissioner Baker McCormick seconds them. Let's take it to a vote.
Motion carried.
All righty, Madam Clerk.
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
I know of none. Does anybody have any? Madam Clerk, what's next without other?
G, public comments.
Do we have any public comment on Zoom? We'll take them one by one.
No one on Zoom.
Any emails received?
No emails were received.
Anybody in the room for public comment? Anybody for public comment? And one last time, anybody for public comment? We have no public comment today. Madam Clerk.
Adjournment.